Okay, it is just a little bit past the hour, so I think we will get started this evening. Welcome everyone from around the country and especially Massachusetts. My name is Polly Mendoza and I'm with AARP Massachusetts. Please let us know where you're from in the chat. You can type in using the chat feature to tell us where you're joining us from this evening. This is our second webinar of a series this month for caregivers, which we offer on Thursdays throughout the month of May. The next three webinars are Making Sense of Caregiving, which is a financial webinar, Home Fit, which focuses on the universal design features to incorporate into a home, and Downsizing and Decluttering. To register for any of those or other activities with AARP Massachusetts, we ask you to visit www.aarp.org/caregivingma. AARP maintains a deep focus on the health, financial security, and personal fulfillment of people 50 and over and their families, and you'll find that reflected in our offerings and resources and in our advocacy. Right now, in every state and all the way to the United States Capitol, AARP is advocating for the issues that affect you most. We're fighting to protect your hard-earned Medicare and Social Security benefits. And we're urging Congress to lower prescription drug prices, support family caregivers, and to stop scams and shut down fraud. AARP is making a big difference and we're taking on big pharma and winning. Medicare is now able to negotiate for lower prices on some prescription drugs, and insulin copays are capped at $35 a month. We're also fighting on proposed cuts to Social Security. You've worked hard to save for retirement. It's your money and you deserve to keep every cent of it. We'll keep fighting to protect your interests here in Massachusetts and across the country. AARP is passionate about protecting Social Security, and we're just as passionate about supporting family caregivers. That's why in this election year, AARP is fighting to get candidates, regardless of party, to offer solutions for supporting family caregivers and protecting our hard-earned Social Security. You'll want to bookmark a few of our pages, the AARP Massachusetts state page, aarp.org/MA, where we post about all of our upcoming events, our wins, and our calls to action. Wherever you are, you can find your local state office by going to aarp.org/local, and this will help you stay informed. As you think of questions this evening that you want to ask our speaker, we please ask you to use the Q&A function so that we can get as many questions to our presenter as possible before the hour is up. And within the next 3 business days, you'll also get the recording sent to you as well. There'll also be a brief survey that we hope you'll take time to complete when we send out the recording. Today's presenter is Teresa Chaklos, a volunteer with AARP Massachusetts, and she volunteers in a variety of our programs, including the Speakers Bureau. Teresa began volunteering with AARP in September of 2020. She retired from the District of Columbia Superior Court in October 2019 after working there for 10 years as a family law facilitator in the Family Court Self-Help Center. Teresa has a Juris Doctorate from Regent University School of Law and a Bachelor of Science in Criminal Justice from Northeastern University. She's certified as a mediator and in group facilitation. Her professional background is diverse, but always focused on work that serves to empower others. Teresa's passion for essentials of caregiving stems from her personal struggle with having to establish care for herself when diagnosed with cancer in 2014 and having to navigate recuperation and movement after 2 major surgeries. We're really happy to have Teresa with us this evening to share this presentation with you. So let's get started. Teresa, I'll pass it off to you now.
Thanks, Polly. Hi, everybody. I saw in the chat people from California and Wisconsin. I'm glad all of you were able to join. So this presentation is all about supporting one another. And we will invite you through the chat to share ideas, ask questions, and hopefully connect with other caregivers and care receivers, people just like yourself. Again, try to hold your questions until the end unless it's something compelling. And always remember, this is a judgment-free zone. Any question you want to ask, feel free to ask. Don't feel like it's kind of out there or anything like that. So when it comes to caring for a loved one or recognizing that we ourselves might need care, most of us don't have a plan until a problem or a crisis emerges. And people can now expect to live 20 to 30 years beyond the traditional retirement age of 65. So now more than ever, it's important to prepare for the future so that you can be prepared for it and or meet the demands of caregiving. See, my little thing is going to work. Trying to change. Okay, here we go. So during this session, we're going to share a framework to help you make plans about care for family members, neighbors, friends, and yourself. Hopefully, after the presentation, you'll feel comfortable enough to connect with other people in your area, exchange tips and advice, and explore available care resources. So, I'm not currently a caregiver, but as Polly mentioned, I did have to quickly develop a team to help me when I had been diagnosed with breast cancer and facing not only surgery, but aggressive chemotherapy treatment for 5 months. So through that experience, I developed a unique perspective, which connects with the practicality and the difficulty in allowing others to help and take over certain tasks. At the time, I lived alone, I worked full-time, and I thought I was quite independent. It was tough to admit that I was going to need help, and as it turned out, I needed help again as I had to undergo spinal surgery less than a year after completing chemotherapy. So I'm going to throw out a few sort of questions to you, but if you are able to put a thumbs up in the chat, fine. But just to help you get a picture of what today's caregiver looks like. If you've helped someone with household tasks like cleaning, laundry, yard work, or helped them with medications, or if you regularly cooked or provided food to someone, drove them to a doctor's appointment, made shopping trips, or run other errands, provided personal care such as bathing or dressing, or helped with finances or paying bills. If you've done any one or more of any of those scenarios I described, that there you will see that caregivers are all of us. And there's also so many other ways that often seem small or insignificant, such as calling someone just to say hello when you know maybe they're not feeling well or they've got something going on. That seemingly small gesture can mean a lot to that person, and it's also a form of caregiving. So what we're going to share today is some practical information to help you as you seek or begin to provide care while also best caring for yourself. So this quote you see on the screen, in my opinion, it implies that when we give to others, especially our time and talent, it fulfills in us our own need to be needed and useful. And that is a great feeling indeed. Now, AARP's founder, Dr. Ethel Percy Andrus, wrote this quote, she was a caregiver to her parents. And in fact, she left her job to care for her mother. Dr. Andrus was an educator, and her passion was to help older Americans lead lives of independence, dignity, and purpose. She founded the National Retired Teachers Association in 1947 and later AARP in 1958. So AARP supports family caregivers and their loved ones both directly through programs and online resources and indirectly through state and federal advocacy. So what we're going to do is break this all down into 5 steps, starting in the conversation, forming your team, making a plan, finding support, and caring for yourself. So in starting the conversation, we often avoid discussions about the future simply because we don't want to think about the changes in our lives or the lives of the people we love the most. We wait until a crisis occurs before talking about our values and preferences, our wishes for healthcare or details about finances. It's never easy to bring up what you think will be an uncomfortable topic. However, a lot of uncertainty can be avoided if you talk before a crisis occurs. It's easy to put off these conversations because they can be difficult and we're busy. But you may be surprised to find that your loved one has been meaning to have the talk too. So, when you're kind of thinking about starting the conversation, here are a couple things to consider. And look for an opening. When raising the topic of future care, you might find it helpful to reference an article you just read or something you saw on the news to break the ice. A couple of examples could be, for instance, I just read an article about gathering all your important papers. Can you tell me where your important papers are, just in case, and maybe what you'd like to be done? Or you could say something like, I'm starting to think about estate planning. Do you have any advice? The other thing you want to keep in mind is to respect your loved one's wishes by trying not to anticipate what you think they might say or how they would react. Just get the conversation started. Be open, express your love and concern, and most importantly, listen. Keep in mind that the conversation will likely take place over time, and make sure your loved one is participating in the conversation as much as possible. Finding out where do they want to live, how do they want to handle their finances, those types of questions are very important. Sizing up the situation means that once you get the conversation going, evaluate what you're hearing. Understanding your loved one's priorities and where they want to live and the nature of their care will help determine the next steps. Now, in reviewing finances, money can be a particularly sensitive subject to talk about, but it is often at the heart of many decisions you'll make. Housing costs, healthcare, and other expenses such as groceries, medication, and transportation are just some of the financial pieces to consider. Ask your loved one to review their bank accounts, their investments or insurance coverage, and other relevant finances, assets, or income that can be used to cover those costs. Find out whether they have any long-term care insurance should they need it. To help you with this task, AARP has created the AARP Caregiving Financial Workbook, a practical guide focused on health, housing, and money management for family caregivers. Each set of worksheets is designed for caregivers to capture the essential information they need to manage the complex responsibilities of caregiving. And there's also a workbook available specific to veteran and military family caregivers, as well as versions in additional languages. You might find that your loved one's initial response to your attempt to start the conversation is something like, I just don't want to talk about it. Keep in mind that some people are private by nature, and sometimes it's difficult to admit they need help. And as a result, you may encounter some resistance. For those of us seeking help, know that our loved ones may have a hard time accepting that we are reaching the point of needing help, especially in situations where we are still working full-time. Trying to do everything yourself can lead to burnout and problems with your own health and well-being. So it's important to form a larger network of family and friends and tap into community resources to share the load. If your first conversation doesn't go well, try again. If you're still running into difficulty, try asking a trusted family friend, a doctor, or faith leader to share your concerns. Now take a close look at this picture on the screen. Here it's clear that the discussion should include multiple generations, such as our children or grandchildren, as well as a spouse or partner. So when forming your team, it kind of seems a no-brainer to look for members who live nearby. Proximity does have its advantages, such as the ability to stop by or drive to a doctor's appointment or prepare a meal. But let's not forget that just because someone doesn't live nearby or have huge blocks of free time, it doesn't mean they can't pitch in. Family or friends living at a distance can help with tasks like coordinating meals, bill paying, or financial assistance, especially those who are technologically talented. Don't be hesitant to ask others for help, even with what you think is a simple task. Some people may only need a little encouragement to take on a simple task and are glad to do so when you ask. I have a friend who lives in Virginia. Her brother lives in California, and she has a sister in Ohio. Their mother is in a nursing home in Virginia where my friend is. The brother handles all the paperwork, all the bills, all, any contracts, etc. Vanessa, my friend, she's the one who's day to day. She visits, she, takes her out to lunch, gets her hair done, takes care of all those needs. The sister in Ohio takes time off once a month. She comes for about a week and stays so that she can take that load off of Vanessa, and she takes care of mom, giving Vanessa a much needed break. They all communicate regularly, either, on Zoom or they'll have a conference call if necessary. So in preparing to build a team, keep in mind that the options for addressing needs will depend on finances, the willingness of your support team, and the resources available in your community. Now, in determining your number of team members, both quantity and quality are important to think about when building your team. Now, and while having a large caregiving team can be helpful, the old saying, too many cooks spoil the broth, comes to mind. So make sure everyone on the team is clear about their responsibilities, and they should be supportive and willing to lend a hand. And in assigning roles and responsibilities, remember, everyone has something to contribute. So play to each person's strengths and be clear on what's needed and expected. Focusing on the care recipient is important for those of us seeking care, because the key and often overlooked person in the conversation is the person who needs the care. For those of us seeking care, barring any mental or physical incapacity or other extraordinary circumstances, you are able to play a significant role in determining who should be on the team and what needs to be done. This is the time to put your needs first. So in making a plan, always remember, doesn't have to be extensive or fancy. You can't anticipate every single detail or scenario, but the plan should include immediate needs as well as plans when the future, the situation evolves. So what I did in my situation was I made a chart and I emailed it to everybody who, upon learning my diagnosis, said, if you need anything, let me know. And I included in the chart, the days of the week, including the weekends, and tasks such as, cleaning house, helping with laundry, grocery shopping, and driving me to appointments. This enabled what became members of my team to schedule some time convenient for them and to complete a task they were comfortable with and able to complete. I learned that we often wish we could help when we learn that a friend, a colleague, or a neighbor needs care, but we get stuck trying to figure out how we can help. So the folks who helped me actually thanked me for letting them know specific ways they could help and for allowing them to help. So in formulating any questions or comments for later, consider this. What has worked for you in trying to start any conversation, and what might you add or do differently in forming a plan? So the next thing is the team meeting. A team meeting is one way to get things organized and ensure that everybody's on the same page when it comes to making and sticking to the plan. If necessary, use your computer and phone savvy friends to assist you in setting up the meeting. It could take place face-to-face, it could be on a conference call, on Zoom, or through a series of emails. Determine what works best for everybody. Then assess the goals and needs of your caregiving plan. Remember, it doesn't have to be extensive. but just try to include those immediate needs and some broader plans for the future. The Family Caregiving Guide offers an assessment of goals and needs, and so after you determine your goals, delegate the responsibilities. That's the time to figure out who will do what. No matter where you are in this journey of caregiving or care receiving, whether you're just beginning to anticipate a need or helping to coordinate a big move or taking care of someone full time, having a good framework to help guide both you and your loved one will make the process easier. So now that you have a team filled with willing caregivers, it's time to start building out that plan and designating responsibilities. And again, always make sure your plan is being made with the person you're caring for at the center of the discussion. And some additional tips are, if you know, if one member, for instance, is an accountant, right? The person who will receive the care might not want that person to take care of their financial affairs. So that's one reason why it's important to have them in the discussion. Communicate. Keep everybody informed as things change and make sure there's no surprises or hurt feelings. Continued communication throughout is a key element through the caregiving and care receiving process. Now, at one point in my care, I had 5 pints of Ben & Jerry's Tonight Dough ice cream in my freezer because everybody was purchasing it and didn't realize that everybody else was purchasing it. I mean, thank goodness I had room in my freezer, but you know, at the time, the first chemo medicine I was on, I wasn't eating right or at all. And they knew that that was a favorite of mine. And they, in their minds, they're thinking, oh, well, she'll nibble on this and this will be okay. But again, it was a lot of ice cream. I did finish it all eventually, but it took a while. So those of us receiving care should also let our caregivers know whether we're having a good day or a bad day. And this will help them in determining whether they should reach out to you or let you rest. You know, nowadays with the cell phones and the texting and all of that, sometimes people think, well, let me just send a text. And then the next thing you know, you're getting like 25 texts and your phone is just pinging, and maybe you're trying to take a nap. So let them know, and also let them know it's fine if you send a text, but if I don't respond right away, don't necessarily worry. Make sure you determine what tasks everybody's comfortable in performing, and also be sure to ask them what are their preferences. That's why I did that chart. I kind of was like, I didn't want to hear any rejection face to face or in person. So I sent it out. That way people had time to think about it, to think about, do I really want to do this? Do I really have the time? And they saw how the times and the days of the week were listed. And to be honest, there were a couple people who didn't respond, but most of them did. And they picked the task and they all showed up at the time that they signed up for. Because in the end, I sent the whole completed chart back to everybody so they had it for themselves and they knew what day and what time they would be coming. It was surprising to me how many people were willing to come to my home and vacuum and clean my house when some of them had hired help that cleaned their own houses. Always remember also, one team member should take notes and write a brief summary of what you did decide. It was me doing it by myself, but I set the chart so that everybody knew what the final result was. And that's considered like a written summary. This way, it helps ensure that the wishes and needs of the person who you're caring for have been considered and included. So the next step is finding support. Locate community, resources such as your local agency on aging. That can help you connect to a variety of support services such as home delivered meals, transportation, adult daycare, care management, and more. They can also answer questions about which resources are free and which may have a cost. You can also check into services offered in your community through the resources section in the Family Caregiving Guide. And then there's something called the Elder Care Locator, which is a public service of the U.S. Administration on Aging. It connects caregivers to local services and support. And any of the resources I mentioned are in that Family Caregiving Guide. The Elder Care Locator can be found at eldercare.acl.gov, G-O-V. And if you're still employed, don't forget to ask your employer if they offer an employee assistance program, because that can also connect you to professionals and other services in the community. You may, I mean, in doing caregiving, you can find that the scope of care that's needed is really beyond what you can provide, even if you started off small and the situation evolves and you get to have, it gets to be a situation where more and more is needed. Some additional support ideas are consulting a professional like a trained social worker or a nurse who can help you sort things out, determine what's needed, find services, and arrange care. You can hire help if that's something that's affordable. If you see that your loved one does need help with daily activities, or try exploring home care options. Some home care workers will do household tasks such as cleaning and meal prep, while others do more personal care tasks such as bathing and dressing. And your local agency on aging can help you identify and connect with appropriate services. And you can also go online and visit AARP's Caregiving Resource Center at aarp.org/caregiving for more information. And to help your loved one be safe and comfortable in their home, try incorporating things that might be helpful, such as handrails or grab bars, night lights, adjustable shower seats. Some of these things, such as installing grab bars, they might be best left to a professional, but you can also check out AARP's Home Fit Guide for a whole range of these sorts of solutions. And again, the website for that is aarp.org/homefit. The guide does provide tips and suggestions and worksheets and resources to make a home a lifelong home. And then there's a variety of options for housing, such as with that might have group dining, locations, laundry service, and more. I mean, so you would need to determine what the criteria is for alternative housing that you might need, and maybe visit several facilities and be sure to talk to residents and their families. Support groups can also be helpful in navigating available care resources. AARP has a Facebook group for caregivers, and as well as online message boards. So if you go to aarp.org and click on caregiving, you're going to find all of these things I'm talking about, including the Facebook page. Remember, the caregiving guide does have resources listed for review at your own convenience. And then again, even for the housing options, you can visit AARP's Caregiving Resource Center. And the web address is also in that guidebook. If you're considering a nursing home, you can also go to Medicare's Nursing Home Compare page at medicare.gov/nursing home compare for more information. And the Elder Care Locator can also be helpful in finding professionals. So step 5 is caring for yourself. Don't overlook the impact of caregiving on you and the person you're planning to care for. Pay attention to your own health and well-being. The best way to ensure that you have the energy to care for someone is to take care of yourself. It's also the best way to help a caregiver care for you. Consider what you know you can and are able to do and volunteer to do just that. Know your limitations and do what is within those parameters. Some additional tips about caring for yourself is tapping into resources like social workers, nurses, and other professionals who can guide you through care options and help you monitor the care if you don't live nearby. Technology such as those personal emergency response systems, remote monitoring devices, and mobile apps can also help coordinate care. And again, ask your employer. Some employers have benefits or services to support family caregivers. For those of us still working, I encourage you to meet with your human resources and or the Americans with Disabilities Act representative. They are a good source of information regarding benefits that might be available to you. And review your own finances. It's important to calculate your caregiving related expenses and account for them in your personal budget. Talk to your doctor. Let them know that you're a caregiver and discuss ways to manage stress. And you should also consult with your loved one's doctor for training if you're expected to do complex medical tasks at home. The Caregiver Advise, Record, Enable Care Act has passed in many states, and you should consult with your loved one's doctor again for training if you need to do those tasks. Take a break. Make time for exercise, sleep, healthy eating, and staying connected with friends. Now, so when I was ill, I have one daughter who lives here in Massachusetts and one lives in Maryland. And the one who lives here, she's a doctor, but she works 7 days in a row and then she has 7 days off. So she would come down to Maryland on that week off. So what I would do for her is, although I had to sort of put my gym membership on hold, they still allowed me, when I asked, to create a situation for her as sort of a guest pass. They gave her a special guest pass number, which allowed her to come into the gym anytime without me having to be present to sign her in. And that way she could work out while she was in Maryland with me, and maybe, you know, for an hour when a neighbor or a physical therapist, whoever, somebody was at the house. So that was able to help her kind of de-stress from her own job, and then also from having to care for me on her week off. Take advantage of caregiving services and support. They can, you know, these groups can really help you through the caregiving journey. So we've wrapped up these 5 steps of caregiving and care receiving, but that is just the beginning. There's a variety of online information, resources, in-person events, and self-paced learning, all for caregivers. And just want to mention the 2 resources you see on the screen. AARP's Caregiver Resource Center, mentioned that a few times already, aarp.org/caregiving. And there's also the phone number there, 877-333-5885. And then there's also the Community Resource Finder, where you can get easy access to resources, community programs, and services through the online resource directory. And that's compiled from provider descriptions and public data made possible by the Alzheimer's Association and AARP. So, have you thought about what might have done differently in setting up a plan, or have you considered how you might start a difficult situation, or how you would set about forming a team? What questions or comments do we have, Polly?
Thanks, Teresa. Thank you so much. This was a really informative presentation. So we welcome people to put questions in the Q&A. That is the preferred spot. I do see that there in the chat, there have been a few questions about the links, specifically one in regards to Medicare nursing homes. And I didn't catch that link. I couldn't find it in the resource companion that I have. So I don't know if you have that, Teresa.
I think it's the one where if you go to Medicare, do you remember? Let me just go through my notes here. The Medicare. Oh, it's called, so it's medicare.gov/nursing home compare.
Nursing home compare. Okay, I'm putting it in the
Yeah,
chat. Great.
all together.
Great. Okay, I put that in the chat for everybody to see. That was everybody was really looking for the links. And it sounds like from the beginning of the chat, we do have some people that are similarly in positions where they're definitely caring for lots of different family members and in different cities, which, as you explained with your daughters, makes it even more challenging. Let's see. And the questions can be anonymous. We won't share information or
I see
anything.
someone's asking how they get the workbook. Again, if you can go online at aarp.org
Yeah,
and if you click on the caregiving link, then you'll see it and you can either download it straight onto your computer or, if you want to print it out, you can. And
yeah,
the
and that was
worksheets are in the family caregiving guide.
exactly. Yep, that was one of the links I put in there. It's the /caregiving/prepare to care planning guide. Let's see. What goes into figuring out what the best care is for a loved one at home versus a nursing home?
That's the whole point of having conversations and involving, the person and family members. One of the things I'm hearing, I'm sure most of you are, is how a lot of people who are aging right now want to stay in their homes.
Mhm.
And so one of your conversations might have to be, well, what would that look like? What do we need to do to make things easy for you or safe for you and how to get around? I can't tell you what's best. It all depends on the need. It might depend on cost, what type of insurance coverage people have. A lot of these decisions are very individual based. And so again, that's why it's important to sort of have these conversations as much as you can, as early as you can before you get to the point of having no other choice. So one thing, I know a friend of mine in Maryland is doing this now. He's looking around at neighborhoods that are close by where he lives for his mom. So that, number one, it would be easy for him to get back and forth to see her. And then he's checking them out. He's talking to staff, and talking to people who are there. And so most of the time you can do that. And so gathering that type of information when you have to make this type of decision, information is the more you have, the better informed decision you can make. Because you don't want to have to make that decision in a crisis situation.
Great, thank you. We have another question that came in through the Q&A, and it says, I've unexpectedly come into caring for my aunt and uncle after my uncle lost a significant amount of money. I've started a conversation about assisted living, but uncle is quite adverse to it. Do you have suggestions on continuing the conversation? It's really not a matter of if, but when.
Uh, well, I mean, yeah, it's like could maybe ask him what are his thoughts about it? Given his situation, what is he comfortable with? Would he want to be around people his own age? Would he want to be able to do activities? Or maybe just see if he wants to go visit a few places and see what they actually look like and what activities they have. So it's tough because so many people have this notion of I don't want to do that, but then some people get there and find out they enjoy it. They don't have to cook. They can cook if they want. They have game nights and there's a group where I live where I go to walk in the park and they have a van and it brings them every morning to the park and they walk around or they sit and chat and they exercise. Um, so that again, that's why that conversation is important. And even if you have to do it like in your situation where it occurred sort of unexpectedly, saying like, okay, so how are we going to move forward? How are we going to deal with the next few weeks, the next month, maybe starting small like that. I don't know what size housing you have, but maybe even realizing, well, I only have, 1 bedroom or 2 bedrooms. Where's everybody going to sleep long term or something like that?
That's great. Any other questions? You can feel free to put them in the Q&A or the chat as well. We can monitor both. It does seem like such a personal conversation. You just have to see what the person wants, and have that conversation with them.
But also sometimes what they want, if it's truly not realistic, that's the other component of the conversation in talking about, what is the reality of the situation? What is the financial aspect of the situation? When you start kind of delving into things a little bit deeper, they may come to see that, okay, yeah, we have, we've got to do something. What are our options?
Okay, I don't see any further questions. And just as a reminder, we will send out the resources and the slides from today in a follow-up email. But we thank you so much, Teresa, for presenting. That was great, and for sharing your personal stories as well. Very helpful. Oh, we got one more question here. Hold on. Yeah, so as a caregiver trying to get a handle on the situation, how do you bring on a team? I figured out most of the financials, but memory is a significant concern.
Yeah, I mean, if you've got, I don't know if you've got family members, if you've got friends, close family friends, people like that, just, if you talk to them, my thing was the chart because I didn't want to deal with rejection face to face, but so many people, I also find people call me even now, when someone they know gets sick. A friend of mine called me about a month ago because her neighbor's mother had cancer. What should I do? What can I do? Should I? And I said, you can just go over with some muffins or food and then just see what they need and let them know they can talk to you. So sometimes people are sort of sitting, like that's when I mentioned about how people get stuck. They're kind of sitting back. They kind of know something's up, but then they don't know, well, what should I do? They don't want to be intrusive. They don't want to seem like they're being nosy or whatever. So just try to just see, if you can, even if you ask somebody to do one small thing, and then if they offer to do something else, like that, just take it, kind of baby steps, one step at a time.
Great, we've got lots of thank yous in the chat. Very helpful. They appreciate it. Can't wait to see the slides. Someone said thank you, taking care of their mother full time. They appreciate the information. Oh,
And
wonderful.
the other thing I always like to make sure people really get this point, if you're the caregiver, don't feel guilty about taking an hour for yourself. Even if you go and just take a shower or you go and have a cup of sit down, in a room by yourself and have tea or take a walk around the block for a minute, that can be so energizing. It can be so healing to you just to have a few moments of your own to just kind of reboot and refresh yourself. So never feel guilty about doing that, but do try, knowing whatever the situation is, maybe make sure that the person you're caring for is safe or somebody else is with them or something.
That's great advice. Wonderful. All right. Well, Teresa, thank you again. This was wonderful, very informative. I always learn something new each time as well. And we hope people will stay with us for the remainder of the May sessions as well. Remember, each Thursday we have a caregiver webinar offered. You can go to www.aarp.org/MA. All right. Have a good evening, everyone. And thank you for joining us. Thanks, Teresa.
Thanks. Take care, everybody.
Bye.